last class, we have dealt with the Garbhapada and Garbhasrava, about the Lakshanas, Nidanas, and the various factors leading to or that should be avoided to prevent Garbhapada or Garbhasrava, which are the losses of pregnancy or the abortions. In this class, we will be dealing with Chikitsa or the treatment aspect of Garbhapada and Garbhasrava. You have to brush up the previous class before going on to Chikitsa. Moving on to Samanya Chikitsa Siddhanta. Tatra Shita Parishekah Avagaha Pradehadidir Upasharet Jivaniya Srida Shira Vanischa Shita Pradeha Parishegadidir Upacharet Pushpe Drishte Adava Shule Bahyanda Snigdha Shitala. Shida Kriyas or those who are cold in nature are accomplished in Garbhasrava or Garbhapada. It is because the Shidas are Shida Kriyas are Stambhana in nature. Pushpa Drishti, that is the lection of Garbhasrava. In the case of Pushpa Drishta or Shula, which are the two clinical features of Garbhapada or Garbhasrava, the Shida Prayoga should be given Bahya and Abhyandara. Bahya and the Snigdha Shida. Also, Rakta Vitta Kriyasha should be utilized in case of both Garbhapada and Garbhasrava. And Shodhana should be avoided. Shodhana Vaksha. Shuddhi Varjam Sahasroktam Acharya. That is, Rakta Vitta Kriya, the treatment protocol adopted in Rakta Vitta Chikitsa can be adopted here except that of Shodhana Kriyas. Okay. Tatra Sarvameva Shiram Yoniroga Garbhasravaharam. In all the conditions, Shira can be utilized. Sega Avagahani Leva Shakkide Tatra Shitale Yonadi Kridakshiram Panasha Sharkaram. Sega Avagaha Leva, that should be adopted according to the symptoms and the presentations as well as the physique of the Garbhini. And the Jivanadi Gana should be utilized. The Jivanadi Siddha Shira can be taken along with the Sharkara. We have said that Shida Kriyas should be advised or should be taken care of in the case of Garbhasrava and Garbhini. Garbhasrava Yukta Garbhini. But what are the contraindications? If Shida Kriyas are indicated, of course, Ushna Kriyas are contraindicated. Kashyapa says, no Ushnodaka Bhave, Garbhachavane, the Garbhadaheta. Hot water use is contraindicated. It is strictly contraindicated in case of Garbhasrava. And Garbhini should be in a position that is that the bed should be soft and it should be comfortable. As we adopt or advise in the case of, we will discuss in the later classes about the various types of abortions. In the case of threatened abortion and inevitable abortions, these are the many types of some of the types of abortions. In the case of inevitable abortion, the once the abortion has been started, it cannot be stopped. But in the case of threatened abortions, we can do some management to prevent the abortion. That is, abortion has been started, but it can be managed without the total loss. We can save the pregnancy in case of the threatened abortion. In such cases, for all the case of bleeding per vagina, in the case of pregnancy, the pregnant woman should be advised in the bed rest cases. And so, same thing has been explained previously or explained in the same way in case of Garbhasrava or Garbhasava or Garbhapada, which are the can be compared to the abortions. In the case of about the position of the woman during the treatment, Shayanam, Tavat, Mridu Shruka, Shishira, Stana, Samstirna, Ishat, Avanada, Shira, Samradika, Padyati. Tam Mridu Sukha, Shishira, Starana, Shayanasta, Ishadavanada, Shirasa, Ubasharet. That the head end should be lower than the foot end. That can be adopted in order to prevent the excess blood flow and also to avoid the shock in the case of shock that can be occurring in the case of hypovolemia due to severe blood loss, and also that can prevent or sometimes can interfere with the continuous blood flow in the case of Garbhasrava or Garbhapada. Okay. तस्य गर्भस्थापन इति उपदेक्ष्यामः पुष्पदर्शनं देवं ब्रूयाः. These two steps, general treatment principle and the position of the patient should be followed with a professional diagnosis when the patient reports to the hospital with the complaining of bleeding per vagina. Once the patient is stabilized, specific treatment should be started, evaluation of the case and the confirmation of the diagnosis. That is the position and the general principle that the use of Shida Kriyas like that should be followed in every cases of bleeding per vagina. That is, we assume that it is a case of abortion. We are not sure whether it is a threatened abortion or an inevitable abortion. So we should be, before that the case is diagnosed, means precisely diagnosed, we have to follow the general treatment principles, which are the we have previously mentioned about like Shida Kriyas and the position of the patient should be followed up to the confirmation of the diagnosis. And the confirmation of the diagnosis should be made immediately without any delay. And the, based on the confirmed diagnosis, further treatment should be adopted. Okay. Before moving on to the proper specific management of that Garbhasrava or Garbhaprada, we should be aware of the preventive measures and about, we have discussed about the various nidanas, and we can do various preventive measures in order to prevent the Garbhapada or Garbhasrava without occurring. That we will see what are the preventive methods. The maintenance of Swastavarta and Sadhrata described for Garbhani should be followed. And various Raksha karma can be adopted. Avoiding Garbhobhagada bhavas, that is Nidana Parivarjanam. And observing Masani Masika Paricharya can strengthen the Garbha and Garbha. Stapana can be, Garbha Stapana methods can be adopted. And the use of Praja Stapana Dravyas. And also Pumsavana in the earlier months where the Pumsavana is an indication of proper Garbhastapana. So these all can be adopted in order to prevent the Garbhasrava or Garbhapada. If you follow this, there will be very low rate of Garbhasrava or Garbhapada will be occurring in the future pregnancies or the current continuation of the pregnancy. About the treatment, the use of Prajastamana Dravyas are very important. So we have to familiarize with what all are the Prajastamana Dravyas. We have to know at least the names in the management to note down these are the Prajastamana Dravyas. They can be used in the case as Shirapagas in order to treat the Garbhasrava or Garbhapada. They are Aindri, Brahmi, Shatavirya, Sahasravirya, Amoga, Abhyada, Shiva, Arishta, Adyapushpi, and Vishwaksena Kanda. This can be used as Garbhastapana Dravya, so the Prajastapana Dravya in the case of management of the condition. Depending upon the condition of the case, different treatment methods should be adopted. The Garbhasravas that's initiated, we have to follow the Garbhastapana Chikitsa, and if it is not feasible or it is not applicable to prevent the abortion, we have to follow the Amagarbha Nirharana Chikitsa. If we cannot stop the abortion, we have to follow the Nirharana Chikitsa. And also afterwards management, Garbhapada Anantara Chikitsa, we have to follow depending upon the condition or the presentation of the patient. We can make use of various Bahikriyas like Shida Vankaha, Shida Parisheka, Shida Pradeha, Shida Ravya Yukta Pijudarana can be made use of, and various Abhindra treatment protocols can be adopted in the case of case. It all depends upon the condition of the patient or the presentation of the case. We will look into the management adopted in the Ashtanga Hridaya. Pushpe Dishte Adava Shuni, Bhahyanta Snigdashida, Sevya Amboja Kirmak Shiri Valka Kalka Najali Vidan, Hare Dionivastibyam Ardadran Pijunantaran, Sadadauda Kritakta Sri Tadambasi Avagahi. In the case of Pushpa Drishti or Shula, the presentations of bleeding vagina along with the pain is presented. Shigna Shidala Kriya should be adopted both internally as well as externally, as we have discussed previously. Use of the drugs like Savia, Amboja, Himakshiri Valka Valka. These drugs should be made into Kalka along with the Hadya and should be taken as a labor in the Yoni, Vasti, and also Ardhra Piju can also be adopted. And Shadda Dauda Gruta can also taken for Apenga. And this drug can be made into Kashaya, and after cooling, it can be taken for Avagaha also. Hiberatirisham moja shrutam jalam. Tityat garba prachalide pradare kukshi ruchyepi. Hiberatirisham Moisturization, Shridam Jalam. Now, these also can be taken for internally for Garbha Lakshana along the Kukshi Ruja. In case of Kukshi Ruja, it has been described in Yoga Ratnavara. You have to by heart at least one context of one sloka of management. It can be either Ashtanga or Sharika. It is very easy to by heart the slokas of Ashtanga for me. According to your concern, you can by heart at least one sloka, but you have to be specific in the management. You have to remember the fact that the Samanya Chikitsa is about the Shidava Srigda Prayoga. And also, depending upon the clinical presentations, the treatment will be different.